Hello and welcome to House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller, and we are back for more healthy conversation, ready to dive into what I think is going to be an amazing dialogue. Many of us have either experienced or we know someone who has experienced chest pains, and that's why today we're going to check up on the new chest pain guidelines that were recently published. So many big changes have been made to emergency care recommendations, and that could have an impact on us all. But luckily for us, we're joined by Dr. Mariell Jessup, Chief Science and Medical Officer for the American Heart Association, and she's going to help guide us through the new recommendations. Dr. Jessup, welcome.
Good morning, Mercedes. It's so nice to see you too.
Thank you so much. Before we dive into our healthy conversation, let's jump into health in the headlines. Good health is always newsworthy, so each week we select one current headline that ties back to the topic at hand, and then we ask our expert to respond. This week's entry comes to us from Verywell Health, and the title is How to Relieve Chest Tightness. Now, Dr. Jessup, this article was written a few weeks before the new guidelines were published. So I have so many questions, such as, is this up to date? And what can you explain to us to help us better understand this term, chest tightness?
Well, that's great. First of all, I think the article is still very much up to date. And the reason I like that article is it describes all the different reasons why someone may experience chest pain or chest tightness. So one person can feel chest discomfort, pain, tightness, because you may have a problem with your skin. You may have damaged a rib. You may have an infection in your lung. It may be related to your heart, and it may be related to your GI system, your esophagus or your stomach. Think about if you put your hand over your heart, there's a lot of things between your hand and your heart. So that's why it is a non-specific complaint when somebody says, I have chest pain. People have a great deal of difficulty even finding the words they want to use. They may say pain. They may feel that it's a stabbing pain. They may feel that it's a squeezing pain, or they may feel it's a constricting pain, or they may say tightness, chest tightness. And in fact, doctors will take a very careful history and try to ask someone who is complaining of chest pain, tell me what it feels like. What are your associated symptoms? When did it start? Have you had it before? All of those questions will help doctors hone in on the cause of chest pain.
And so, Dr. Jessup, how can we, and I know we're going to dive into this just a little bit more throughout the day, throughout our conversation, but how can we relieve or take steps to relieve some of that tightness?
Again, that's a great question. The concern, of course, that we're talking about is chest tightness that's related to your heart. And what we think that the reason people experience chest tightness is that there is a blockage in one of the heart's arteries, the coronary arteries, that is preventing enough blood to get to a certain part of your heart muscle. So just as if you were to put a tourniquet around your arm, after a while, your fingers and the muscles in your fingers would start to hurt. That's the same thing that's happening to the muscle of your heart. So if you're developing chest pain that's related to your heart, people will often say it's a squeezing, and they'll squeeze their hand like I'm showing you now. That was one of the earliest descriptions of angina, which is another word for heart pain. If someone develops angina while they're exercising, the first thing to do is stop exercising and sit down. Of course, when somebody has chest pain, it has to be in the context of who they are. Just as if you were to sneeze repeatedly in the middle of a flower shop, you wouldn't say, "Oh my goodness, I have COVID." Your first thought is, "I'm allergic to some flowers here." So, for example, if you're a 21-year-old healthy person without any medical problems at all, and you've just eaten a whole kielbasa sandwich with lots of peppers and onions, and you get chest pain, you're not having a heart attack, you're having indigestion. On the other hand, if you're over 50, and especially if you have high blood pressure or diabetes or smoke cigarettes, and you've just been exerting and walking briskly after a heavy meal, and you develop chest tightness, it's really important to stop walking, reflect for a minute, see if your symptoms go away. If not, that's something you need to do something right very quickly. Call 911 and get to the emergency room.
Dr. Jessup, this is so much. This is a wealth of great information that you're providing for us. And, as I mentioned, I have so many questions, but you know what? Our viewers have so many questions as well. So let's jump into more continued dialogue with our segment that we call You Ask, We Answer. So we're so excited to learn more information about the new guidelines. So we want to dive into our questions. Our first question comes to us from William, and he's out in Birmingham, and he wants to know that the recent headlines in the new guidelines have recommended seeking emergency medical care if you experience chest pains. So how do you know if you're having the chest pains that are severe enough to seek medical help?
It's a great question, and it's the reason why so many people delay care. So what the guidelines suggest is for people who are at risk for a heart attack, don't worry about them making fun of you in the emergency room or saying you're wasting our time. Get to the emergency room and let an experienced medical team tell you whether your chest pain is related to heart disease or not. Again, it has to be taken into context. People under 40 years of age, except under very unusual circumstances, are unlikely to be having heart disease, but that's not 100% sure. But for men, especially over 40, and for women over 50, in general terms, if you develop chest discomfort and it doesn't go away within a couple of minutes of you resting, it's important to get to the emergency room and let an experienced team evaluate you. The problem is not enough people go to the emergency room to have their chest pain evaluated.
Mm-hmm. We have another question coming into us from Kate, and Kate says this: when I think of chest pains, I immediately think of heart attack. Is heart attack the most likely diagnosis?
I think that's an important question. And again, it depends on what group. If you have a bunch of college age students and they get chest pain, then I wouldn't think of a heart disease. But if I had a room full of retirees, 50% of people over 50 have hypertension. Many people are overweight and physically inactive, and they get chest pain, then I would absolutely think of heart disease as a major consideration. Heart disease is common. Heart disease is common in men, and heart disease is common in women. It's not just a man's problem. So our level of suspicion, especially in people over 50 years of age, needs to be high.
We have another great question, and this is coming to us from Harry, and he says this: why do the new guidelines recommend that I go to the hospital by ambulance if I'm experiencing this pain? Can I just ask a family member to take me?
It's always tempting to want to go in your own car or have a family member go to the emergency room with you. Here's the problem, and it's scary. Sometimes when the chest pain is related to a heart attack, you may have an irregular heart rhythm called an arrhythmia that can be lethal. So you could either be driving in a car and experience this life-threatening arrhythmia. Not only might you pass out, but you might hurt other people. And the same thing could happen if somebody, your family member, was driving. Here they are driving you and you pass out. What is your family member supposed to do? So seconds count, minutes count when somebody is having a heart attack, and you want to be in the hands of experienced emergency personnel as early as possible. That's why we say call 911.
Great advice, doctor. And I love how you say seconds count, minutes count, and we don't want to waste a moment. So here's another question that came to us from Megan. Megan wants to know, do women experience chest pains differently than men? And how do the symptoms differ?
It's a great question. The truth is that if you take all the women that have chest discomfort because of a heart attack, they have pretty much the same symptoms as men. However, there's a significant portion of women that don't exactly experience the same symptoms when they're having a heart attack. Men classically, and we say that, we mean typically on average, men will usually have a squeezing heaviness in their chest. They may describe sweating. They may describe shortness of breath. That's pretty typical. The chest pain in men tends to be more in the front part of their chest. It may radiate or travel up to their left arm. Women may have somewhat different. They may have more of a heaviness rather than a squeezing sensation. It may radiate or travel to the back of their chest, into their back. It may go up their neck and into their jaw. They may be short of breath, or they may have a feeling of what we call impending doom, feeling like this isn't right. So it's not the same general symptoms. It does begin often with a chest abnormality of sensation, a chest heaviness.
Mhm. Doctor, we have another great question, and this is also one of my questions because this has happened to me. So Diane says this: I went to the doctor for chest pain, and the doctor says, I have nothing to worry about. I'm completely okay. What should I look for in the future? Is there anything that, any signs, any symptoms that I need to pay attention to in the future?
I think Diane needs to ask her doctor more questions. So what does that mean, that you're fine and you have nothing to worry about? Does that mean you have no risk factors for heart disease? Does that mean your blood pressure is perfect, your cholesterol's perfect, your weight is perfect, you're exercising regularly, you're not smoking? Because if any of those are not true, in other words, if you have risk factors, then I'm not sure you need to worry, but you need to pay attention to those risk factors. So when a doctor says that to somebody, just say, you mean I have no medical problems, doctor? Or the chest pain I'm experiencing right now is not a symptom of heart disease. So be specific. Don't be afraid to really probe into this. Remember, Heart disease is common. High blood pressure is common. Diabetes is common. So we need to take our personal responsibility and say, do I have any of these? And if I have these risk factors, how can I correct them? If, on the other hand, you've had chest pain, the doctor says, don't worry, you're not having a heart attack, but let me know if you have this again. By all means, tell your doctor when you're having those symptoms again.
Very good advice. And speaking of those conversations, those important conversations that we have to have with our doctors to get more information, Charles wonders this. Medical terms are so hard to understand. I don't understand the medical lingo. So, what tips do you have to help us have more meaningful dialogues with our doctors?
Well, I think it's really important to go into your doctor with a written set of questions. Now, don't go crazy. Don't walk in with 25 questions. No doctor wants to answer 25 questions. But if you have one or two or three key questions that you want to understand, write them down, show them to your doctor or the nurse that may see you before the doctor to make sure they cover it. Don't be afraid to turn on your phone and the record button, and so that you have the recording, so you can, when you're not so anxious, listen to the answers, let your family members. So that's pretty easy. Almost everybody has a phone now that can record a conversation. Of course, you tell your doctor and nurse that you're going to record them. And that makes it much easier to listen when you're more relaxed. And then if there's something in particular that your doctor is stressing to you and you don't understand what the doctor is saying, just say, Doctor, I don't understand. There's nothing wrong with that. It's hard to communicate to people under the best of circumstances. We're having lots of trouble communicating with one another lately. So don't be afraid to just say, I'm not sure I understand. Finally, I would say if you can bring somebody with you to the doctor's office, that really helps because there's two sets of ears rather than one. And the recording really helps because you can go home and have a good friend or a loved one listen with you, and you can figure it out. And the final thing I would say is most doctors now have a way of communicating electronically, and you can get into your medical record. And if you get home and you still don't understand, write a note to your doctor. Oftentimes the nurse will answer the question, but the nurse will usually have discussed it with your doctor. So there's lots of ways to take advantage to modern technology, and it'll make a better conversation. And your doctor will be happy that you've taken the care to make sure that you're doing the best for yourself.
Absolutely, doctor. A lot of the tips that you've just provided, they put me in the mindset of a term that we use called shared decision making. Can you explain to our viewers what shared decision making is and why it's so important and how they can get a little bit more involved in their own care?
It's such an important term, shared decision making. That means that you're not sitting back as the patient and saying, okay, doctor, tell me what I should do. It's important that you tell your doctor, listen, I understand I have a serious condition, but I don't want to have surgery ever. I don't care what you tell me. I don't want to have surgery. So please help. Let us just decide a course of action that's the next best to surgery. It means that you are feeling safe and secure in asking lots of questions, and your doctor and any other doctors that that doctor may need to talk to can work together with you in the team. So you're not standing outside the medical team, you're part of the team. In fact, we say you're the center of the team. So that any crucial decision, say that you need surgery or you need a certain procedure, or that you're going to go home without treatment at all, or palliative care, or even hospice, is done with you in the center of the medical deciding team. And that's what that means. And it's important for all diseases now, but many cardiovascular disorders, the treatment is reached by a shared decision-making process.
Dr. Jessup, this show has been phenomenal. A wealth of great information that you've shared today, and we thank you for always coming by, not only gracing us with your presence, but equipping us with so much great information so that we can take a little bit more ownership of our health. Is there anything that you would like to share before leaving us today? Because I know you have a flight to catch.
Thank you. It's always lovely to talk to you. I would just emphasize what I've tried to say these last few minutes. Do make your health important to you. This is not somebody else's job. You are the person that's going to take charge of your own health, and be assertive. Say, I need to understand, I need to know. And I would say that the American Heart Association has a great informational website. You can look up any kind of cardiovascular disorder. You can look up angina. You can look up high blood pressure. You can look up aortic valve disease. And there's really good information there. So that's a good place to start, even before you go to your doctor, or after your doctor has said you have something. Go back and read about it on the American Heart Association website.
Dr. Jessup, thank you so much for spending time with us today. Always a pleasure. That does it for our show today, friends. Hopefully you have taken great notes, because I know I did. And you know what? This is a perfect opportunity not to only just utilize the notes that you've gleaned today, but you can go back and you can check out any of our previous episodes on our YouTube playlist. And there's something else that we want to make sure that you understand is happening right now. It is open enrollment time. And for those of you who get your healthcare coverage through the Affordable Care Act, it is your time to re-enroll. So we want you to take advantage of this. Don't miss out, because we want to make 2022 our healthiest year yet. Friends, take care and take care of each other. And we'll see you next episode. And before you log off, take a look at this.
So my name is Jennifer. I live in Virginia. As a self-employed tutor, healthcare.gov means security for me, financial security.
A positive 5.
As a sole proprietor, it really does come down to me. If I'm not in my chair tutoring, I am losing money.
Okay, perfect.
If you don't have healthcare, then you are pretty much one medical emergency away from bankruptcy at all times. And that's, for me, why it's important to use my healthcare for preventative measures, going in for annual checkups, well woman visits, and things like that. If you go to healthcare.gov, you're going to be able to find a good deal, because there's a lot of providers and there's a lot of options. My rate actually has gone down significantly, and I can also every year choose a plan that works for me. Healthcare.gov is peace of mind.
Hey Sandra, how are you?
Because now I know that no matter what, I can find an affordable plan where I can go to the doctor, take preventative measures, and live my life.
New law, lower prices. More people qualify. Enroll by December 15th to get coverage starting January 1st, 2022. Healthcare.gov. Produced by the U.S. Department of Health and Human Services.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.